Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
and effect of estrogen and progesterone on endometrial biopsy. If it is estrogen predominant, in estrogen predominant states, endometrial biopsy, you will see short, straight, narrow tubular glands are seen. Short, straight, narrow tubular glands are seen in the proliferative stage, whereas when it is progesterone predominant, then you will see that the glands are coiled, convoluted, or corkscrew or sawtooth appearance of glands is seen along with the secretions. Basal vacuoles are characteristically present in um, are present on endometrial biopsy. At ovulation, you can see basal subnuclear vacuoles are seen. If you give continuous progesterone use for a longer time, it causes endometrial biopsy. And this is the basis of use of progesterones in hyperestrogenic conditions.
Continuous use of progesterone will result in endometrial atrophy, and that is the reason why we use progesterone in hyperestrogenic states.
thank you and thank you for watching.